Dr. Yanzhong, who is the Senior Fellow for Global Health at the Council on Foreign Relations and Professor and Director of the Center for Global Health Studies at Seton University School of Diplomacy and International Relations. He has a forthcoming book called Toxic Politics, China's Environmental Health Crisis and its Challenge to State Power, that Cambridge University Press will be publishing later this year. So 21st Century China Center at UC San Diego invited Dr. Huang to visit us today to give a talk on the way China is managing the COVID-19 crisis, and to compare it to the way China has handled previous epidemics like SARS. So without further ado, I'm going to turn it over to Dr. Huang to help us understand and get a good objective view of how China is managing the crisis. Thank you, Dr. Huang.
Thank you, Susan. Can you hear me?
Yes, perfectly.
Great, yeah. Thank you all, and thank you, Susan Lei, for inviting me. It's really a pleasure, even though I cannot be physically there, but I'm honored to speak at this webinar. And I know many of these faculty members at UCAD use as leading scholars in the field, and Susan certainly probably I haven't mentioned that to you, that when I was a graduate student at the University of Chicago, my mentor, Danzo, mentioned to me a couple of times your name. So that's how you have long heard your name. So anyway, thank you all for participating, attending this webinar. Today we're going to talk about this comparison between the China SARS outbreak and the COVID-19. When we do the comparison, it's very clear, right, that there is certainly a strong parallel between the two when we comparing the initial, the government response to the initial stage of the crisis, right, back to 2003. Actually back to 2002 in November, the first case of the SARS virus was known to occur in mid-November 2002. And by late January 2003, the Ministry of Health was aware it was a dangerous new type of pneumonia in province, the Guangdong province, but the government did not basically take any effective action on it. It did not issue a nationwide bulletin to hospitals with instructions for preventing the spread of the virus until April 3rd. And in the meantime, they were basically denial there was a dangerous outbreak happening in Guangdong. And so that cover-up continued. It was not until mid-April that it formally listed the SARS as a disease to be closely monitored. And the government then launched a crusade against the SARS virus that beginning mid-April. And essentially we saw the similar developments during the COVID-19 outbreak, right? That there was now the first case, according to the government, the media reports, likely occurred again also in November 2019, and in late December they already, there's some whistleblowers, including Dr. Li Wenliang, was sharing this information about potentially this coronavirus or SARS, what they called, being spreading around, but they were disciplined by the government for spreading the rumor. and there were also the infection of the healthcare workers. In early January 2020, that was a clear evidence of human-to-human transmission, right? But the government did not admit that there was a human-to-human transmission until January 20th, right, when Zhong Nanshan made that announcement on the human-to-human transmission of the coronavirus. And in the meantime, the local governments really did not do anything to effectively stop the spread of the virus. You know, we heard that this story, right? How even on January 20th, they were still celebrating, right? This event, the potluck, you know, have 40,000 families sharing dishes, you know, and that was like a fertile ground, you know, for the spread of the virus. So that was the comparison, right, in terms of the government response to the first stage or the initial stage of the outbreak. But then you could also compare the government response to the second stage of the outbreak, right? In SARS, we just say that after mid-April 2003, the government took decisive action against the SARS, you know, that seems to be effective in preventing the further spread of the disease. So essentially, in late May 2003, the cases began to drop. And in August, China declared actually SARS-free. And in this case, we also saw very decisive government action being undertaken since January 20th, when that human-to-human transmission announcement was made. President Xi made this decision on quarantine or shut down the Wuhan city. You know, that led to a crusade against the COVID-19. The government seems to be very effective in mobilizing the society, mobilizing the state to prevent the spread of the virus beyond Wuhan. They also made efforts to maximize the healthcare system capacity by building two hospitals, the Huoshenshan and the Leishenshan, right, within 10 days. They built a lot of those so-called Fangchang Yiyuan, the cabin hospitals. You know, I don't know whether this is the right translation, but it was derived, I assume, from that Noah's Ark, you know, that story. Those Fangchang Yiyuan or mobile hospitals are used to basically handle those mild cases. And so that was also seems to be effective in bringing down the cases. But when we compare this response to the 2003, the response to the SARS outbreak, it was, even though the government, you know, also took measures at that time, you know, sealed off the villages, apartment complexes, you know, launching the patriotic hygiene campaigns. It was not carried to such a large level and to such an intensive degree as we found in Wuhan and beyond. You know, so one of the differences is this campaign against the coronavirus was unprecedented in PRC history. And you could actually also say it's unprecedented in modern public health history. So that is one of the difference. The second difference is that the widespread uses this war metaphors, you know, that they call it the 战役, right? That it means that the campaign or the battle against the virus is used very frequently. They're also talking about the, in certain districts using the martial law, right, to impose the quarantine measures. Very draconian approaches being used. So are these measures effective? I think President Xi yesterday showed up in Wuhan. I think that signaled that situation is being stabilized, not just in other parts of China, but also in Wuhan, the epicenter of the COVID-19. Some people might suspect that was indeed the case, whether there was any data reliability issues, but my sense is that the real the government data, that is, there were essentially zero cases in many provinces, and even in Wuhan, you're seeing the significant drop of the cases. That seems to be real, and the situation is indeed getting stabilized, but interestingly, also different from the SARS period, right, which actually triggered the very close international cooperation, including the close U.S.-China collaboration over the infectious disease outbreaks. This time we are seeing these two countries, right, that criticized each other, finger pointed each other, and I thought this could be a great opportunity for the two countries to reset their deteriorating relationship, because usually when you face a common challenge, right, that naturally requires you to work together, to get closer. But that seems to be not the case in the U.S.-China relations. And also different from the SARS outbreak, which actually
Fox 5 News
opened the political window.
Led by the DEA leads to more than 600 arrests.
I'm sorry.
Could somebody mute, please?
Cartels in Mexico.
More than 100 of those arrests were made right here in San
Maybe
Diego.
it's from mine. I think let me just
details on an
close
operation
it.
called Project Python. Misha.
Yeah, good afternoon, Maria and Andrew. The 6-month operation got millions of
We're
dollars
working
worth
on
of drugs
getting that
off the
unmuted.
streets,
1 second, please.
heroin, fentanyl, meth, and other things, guns as well. The DEA believes that they did put a pretty good dent in this major Mexican drug cartel, but the leader, known as the Ghost, still remains elusive.
We'll meet you on the battlefield, but leave your kids at home.
It's laptop 5 is the problem, according to.
Okay, they're muted now. Sorry about that, everybody.
Okay. Where's Dr. Huang, though?
I thought it was my. I'm muted
okay.
now.
No. Okay. So
I'm on mute now. I'm muted. Okay.
Go ahead.
Can you hear me now?
Yes. Please continue.
Okay. Well, let's continue. There's another difference is that the SARS basically opened a political window for at least for a short period of time for more transparency, for more openness. That President Premier Wen Jiabao publicly basically said, this outbreak basically taught us a lesson, that we should not just rely on one country, to deal with this a global challenge. So China became very cooperative, and even when he was showing up at the ASEAN 3 meetings, he was like close to admitting that we messed up things. Sorry for that. But the current this case seems to suggest something very different. Right? In fact, now you look at the Chinese media, especially the official media, it was all about how the case shows the superiority of the so-called China model, right? There was a book coming out praising, this how effective the Chinese approach was in containing the spread of the virus, and was certainly was that the rapid spread of the virus worldwide, in countries like Italy, South Korea, and the United States only, right, that provide this evidence supporting that this Chinese approach seems to be better than the Western approach. So there, when you look at all those projects, there's that are already this call for applications being out, talking about the lessons drawing from the crisis. There was nothing about certainly how the political institutional reform. So my sense is that probably that political window has been already been closed. I suspected that Dr. Li Wenliang's death on February 4th actually provide a catalyst for that early closure of the political window. We remember that that night when that news came out, I think Weibo, this comments increased to like 800 million just at the midnight time. So that really probably, I think, raised the red flag to the Chinese leaders. So that led to a new round of a crackdown on social media. So the outbreak indeed is very unique. That especially when you look at those drastic government containment measures since January 20th and its effectiveness and how it actually affect the U.S.-China relations. What's the implications for the China model? There are a lot of things actually to digest here. So I will stop there. Susan, to you.
Okay. Well, that was very informative. And, comparing the current epidemic to SARS and thinking about it as a political phenomenon and not just a health phenomenon. Of course, in 2003, Wen Jiabao and Hu Jintao couldn't be blamed for the initial cover-up because they were just coming into office then. That was the start of the new administration. So it did give them an opportunity to try to cast a new image, and they fired a lot of high-level officials, including the Minister of Health and the Mayor of Beijing, and they opened up the media and the internet, and so I think they had the advantage of they couldn't be blamed for it, so they could take advantage of the opportunity in a way to mobilize all of society in a positive way to try to address it. Although, as you say, they also still had some pretty strict quarantining practices. But it is interesting that now, of course, it's not as easy for the current leadership to say our hands are clean about the beginning. And so there's a lot more defensiveness. And also the policing methods and the surveillance methods have really strengthened and expanded compared to 2003, right? More than 15 years ago. And way when grid system and surveillance is now, very pervasive and very efficient. So that's another difference I think we see. You have any thoughts about that?
Yeah, absolutely. I forgot to mention that actually, indeed, that the Hu Jintao, Wen Jiabao, since they were new, they when they took over, they want actually incentive to to strike a new theme different from the predecessors. That indeed, I think is set the background for those, however brief period of transparency and openness. But now you have this incumbent leader, right? That I think some might consider that it was he should be responsible for that. So that was actually certainly this is something that could affect that how the leaders actually respond to the crisis and also draw lessons from the crisis. And I also like that your comments that this policing method is also different now, especially now is different from the 2003 when at that time there was the internet already started to become popular and the short messages, but people, this is the main way for people to communicate with each other. But nowadays, right, that you have seen, right, that the WeChat become more popular, but on the government side, they are actually become increasingly using big data, even drones, right, to police the implementation of the quarantine measures. I found it really, really fascinating that one of my friends, when he returned from the United States back to Shanghai, and initially, right, that their system didn't show that he's been to the U.S. Right, he returned basically in early February. And so he was still allowed to, freely walk around, go to different places. But then, in 2 weeks, then they found actual system could show that he's been to the States.
Well, I think also the lack of civil society to turn to now in China has something to do with the friction and the inability of foreigners to really help people in China now, and for China to take advantage of the opportunity to build a little goodwill with Americans and with people in other countries. Because I don't know about you, but when I heard about the terrible suffering of the people in Wuhan and Hubei province, my first instinct is I want to go send a check to the International Committee of the Red Cross or CARE or some other international NGO. But those organizations are not allowed to operate in China. So they don't have a Chinese presence. And the Chinese NGOs have really also been suppressed. So we really only have this one monopoly Red Cross of China, Chinese Red Cross, which has a reputation of being quite corrupt and inefficient. And so there was really no way for ordinary people like me to help the people of Hubei province or the people who were suffering in the epidemic. So I think all we were left with was the messaging by governments, which was not very compassionate on the US side. And it wasn't, and it was kind of prickly on the Chinese side. So I'm wondering what you think about that.
Well, absolutely, right? If you to compare this NGO's involvement, right, in the when trying the earthquake in 2008, well, there was actually again a brief period of time that NGOs were allowed to play a bigger role in supporting those rescue efforts. But this time, what is basically all this the dominant role of the government, right? Implementing the containment measures. This is a completely top-down, draconian approach. That without pre-consulting the social forces, even their feedback. also make it sort of difficult for the foreigners, like people, even though they want to help, there's no channel basically to help. You want to send money, but then when you think about this corrupt, Red Cross, that, why do I send money only to be misused, right? So a lot of people choose to send the facial masks. Actually, I was involved actually to help the local sort of my hometown, the country people here, basically we raise the money and then buy the masks and protection suits and send that back to the hometown.
Right. So you like many other Chinese Americans or overseas Chinese were using your personal networks to try to help and to work around the Red Cross rather than through the Red Cross. I spoke to other people who were able to do that as well, but it's fascinating and really kind of sad that the only way to do that was through these personal kinds of connections.
Right, exactly, and that might also explain why. Well, in a way, the Chinese, the foreign ministry spokeswoman, right, say that's basically the U.S. didn't provide anything, right, to China. That was certainly what they overlooked, the fact that there was indeed the support from the non-governmental sector in the in the U.S. But the pledged 100 million, I don't know whether it materialized or not.
Well, I hope so. And before we open it up, I want to ask you about some other things that we observed in terms of the leadership response to the epidemic this time. One of the things that was very interesting was creating this leading small group led by Li Keqiang. Others, so many of the leading small groups are led by Xi Jinping, but he made this one to be led by the premier. And, and we observed the people he put on there were quite high level and people who are in charge of propaganda and foreign affairs, but not too much expertise when it actually comes to public health. So I'm wondering what you thought about that.
Well, probably you know better than I. You're the expert Chinese public policy process. Yeah, that's this LSGs, the leading small groups. That's sort of very unique to Chinese policy process, right? The way there's an issue that needs to be tackled, right? As a priority, you build up a leading small group, right? The person, the head of the LSG, usually is the person actually in charge. But this time seems to be a little bit different, right? Even the Premier Li Keqiang is officially the head of the LSG, but President Xi said that I'm personally in charge, So really sometimes you don't know what exactly happened with the LSG and how it functioned. Very often we saw was like Sun Chunlan, right, the Vice Premier Sun was a person on the front of tackling the crises, and Premier Li showed up in Wuhan, I believe, once, but that seems to be all, right?
So, yes, it is very interesting that Xi Jinping wants everyone to see that he is in charge, and a lot of the propaganda now is showing, the great wisdom of Xi Jinping in tackling the epidemic. And they even went so far as to publish a speech that he supposedly gave back in February, but it was a speech to the standing committee in which he said that he had really been issuing instructions from January 7th. And yet he didn't make any public remarks until 2 weeks later on January 20th. And that was kind of puzzling because you might be able to say that the failure to inform the public could be blamed on the local officials in Hubei province in Wuhan.
Mm-hmm.
But then this speech indicated that in fact Xi Jinping, from early January, he said he was in charge. So if he was in charge, why was the public not really informed?
Right. Well, this is also another part that is really puzzling us, especially given that the full speech on January 7th remains to be revealed. We don't know exactly what the President Xi said, because it seems that the Xinhua, well, I think
Chao Shi. It was Chao Shi published
Chao Shi,
it.
right? When they published, it's not the full speech.
Uh-huh.
So I sense that this maybe reflects something that is very interesting in the political system. The sort of the what I call the buck passing politics. Basically, if you look at every major actors in the system in responding to the outbreak, everybody seems to be saying, it's not my fault. The Chinese CDC say blame the local government officials.
Mm-hmm.
Local government officials blame. It was that I need essentially implying that the central leaders didn't issue the explicit directives,
Right.
and the President Xi that said I already issued the directives. So
Mm-hmm.
really, this seems to be like nobody is accountable for here.
Okay, well, let's open it up to the other participants. If you'd like to ask a question, please make it very succinct, and you can let me know you'd like to ask a question by waving your hand. Zoom is an amazing software. You can just put your video on and then wave your hand. So that will tell me that you'd like to ask a question. The other way you can do it is by sending a chat to me or to Lei Guang, but then that requires me to go to chat and see who's there. So the best method really is to wave your hand. So let's see if anybody can do that.
Hi.
Okay, yes, I see, I see David Smith. Are you David Smith?
Hi, this is David Smith in San Diego. I used to cover you when I was with the Union Tribune.
Okay.
Thank you for this. Thank you for this presentation. My question is, I'm very curious because of what China, if anything, has been doing to separate the farming of swine and fowl and say other animals, because this seems to be, the root cause of many of the viruses that we keep getting, from China over and over and over again.
Okay, good question. Dr. Huang, would you like to answer that?
Oh, I'll try. I think that is indeed that's a risk factor there, right? That you have these different animals, swine, chickens, and all mixed because this sort of like a mixing bowl there that could actually leads to the generation of a new novel virus. But this time, with the origin of the virus seems to be remain unknown. We still don't. Scientists still don't have a consensus on the origin of the virus. But many scientists agree that it seems to be caused by bats. Then the intermediate host is the pangolin. And because pangolin is considered a delicious delicacy in China, so when people are eating them, that actually is increase the exposure to the virus. So that was how the virus jumped species, right, from animals to human beings, according to many scientists.
Dr. Huang, didn't the state council just pass a new law that's basically banning all these live animal markets?
Exactly. The Chinese National People's Congress, they just banned permanently banned the consumption of wild animals that that include fish, certainly. But again, what the issue, I think this is a very good step. It's, I think, needed. That's very important because if you then back to SARS, that's also right. Even though it could be tracked to bats, but the intermediate host was the civet cats, right? They're also considered a delicacy in China. So there was a brief period of ban on the civet cats, but then that the people just forget about it. So the concern here is whether how do you enforce the ban, right?
Yeah.
It's just like changing a control here, right? It's not that easy, right? Otherwise, that you won't have that still such a large population in China smoking.
Okay, yeah. Yanzhong, would like to ask a question. Yanzhong.
Hi, Yanzhong from Berkeley. So Dr. Huang, I'm a big fan of your work, and I wonder, can you speak briefly on the similarity and the differences in terms of how the United States is dealing with the coronavirus right now and what was going on in China?
Thank you.
You mean difference between US and China?
Yeah, similarity and differences. For example, this whole comparison between flu and coronavirus that was also happening in China, and now it is a main sort of discourse in the United States, and a lot of officials are still saying the danger is very low and so on. So I wonder if you can talk about similarity and differences.
Well, first of all, we need to talk about this nature of the virus, right? It is certainly very characterized with high transmissibility, right? I think in terms of the R0, that is the reproduction number of the virus, seems to be higher than the SARS, but the virulence of that virus is lower than SARS. The SARS has a case fatality rate of 9.6%. That means 10 out of 100 confirmed cases will die. But this one, according to WHO, has a case mortality rate of 3.4%, which I think still overestimated the actual mortality rate, because 83% of the death happened in China, mostly in Hubei province. So if you use the South Korean data, it's about 0.7%, which is very close to the mortality rate in provinces other than Hubei. And 81% of the cases actually are mild, and that in terms of the the people who are vulnerable to the outbreak, to the virus, essentially are elderly people especially aged over 60. The virus is, and we also don't have know much about the virus. There's a lot of unknowns about the virus that I think maybe also increased the anxiety and the fear or even panic about the virus. So I think it is natural both countries, when we're dealing with this novel virus, they made mistakes, that the United States made mistakes too. I think one of the mistakes they made was that when that outbreak was occurring in China, they should have imposed a very strict the border control, probably this is not the right word, screening and treatment measures be in place. So initially they only actually prohibited the entry of the Chinese citizens, not the U.S. citizens, and the permanent immigrants. I'm not saying they should deny their entry. It's just that I think they should be strictly screened. And then if they found those cases, they need to be quarantined effectively instead of basically let them go, right? And some said, well, you're staying at home, right? But there's really no strict enforcement of the quarantines, right? So that actually allowed the virus to spread in the country, right, for weeks. Right? There's really not much as being down there. I think in terms of the inaction, that might be the problem that you could say, well, China, there was a period of inaction. The US, we probably saw that too. But when you talk about whether there was deliberate cover-up on the US side, I doubt it, because I believe the US CDC is a very professional organization. It's unlikely to be politicized that easily. They're not listening to the Trump administration, in my opinion. Even though there's maybe the CDC director, even though he wants to, right, the people there, the media, right, they won't allow that to happen. So I think we should keep in mind also that when we talk about the response to the outbreak, right, China basically essentially is the government doing everything, right? And here, even though you see that the government might not be doing that much, we're already seeing that universities, schools, companies, but this is part of the civil society now, they're very actively responding to the crisis. I actually served on the university the health intervention committee. Basically, each day we meet for 1 hour talking about how the university should respond to the crisis. So there's a lot of actions being going on in the society, at the society level.
Great. Dan called in and would like to ask a question.
Yes. Can you hear me?
Yes.
Yes, I was just wondering what the basis was for saying that there were no, other than the Red Cross, there were no opportunities or avenues for Americans to aid the China relief effort. For example, direct relief, which people can refer to at the internet at www.directrelief.org, notes that together with FedEx, which donated airplanes to them, they have provided more than 30,000 pounds of protective gear, 800,000 and 95 in surgical masks, and more than 400,000 gloves, numerous overalls, face shields, and so on. There are a number of other U.S. organizations that are very actively involved in China. And in fact, I wrote to the New York Times and asked them to please publish the names of some of these organizations, but they took no action to do that, even though in previous worldwide health catastrophes, they have done that, which kind of led me to think maybe they were more interested in scoring political points against the Chinese government than actually assisting in humanitarian aid.
So why don't you say the name of the organization again? Because I didn't know about that. I couldn't find it. So if people are interested, they should know. Say it again, Dan.
Yes, it's directrelief.org. And they have an website, www.directrelief.org.
Okay, very good. Thanks so much for letting us know about that. Victor, I think we should move on to the next question, if you don't mind. I mean, unless Dr. Huang, would you like to say anything about that?
No, I'm good. I'm good.
Okay. Professor Shirk, Victor Shirk, my colleague at UC San Diego. Yeah.
Hey, Yanzhong, how do you do?
Hey, Victor, good to see you.
Yeah, I know. Yeah, unfortunately, this couldn't be in person. So you've done a great deal of work on also sort of you wrote about kind of the shortfall of clinical care in China. This was a few years ago. What did this case, especially in Wuhan, reveal about weaknesses and strength of clinical care for, patients with infections in China today?
Good question.
Well, great question. That when I think when the government implemented these measures to seal off the Wuhan city, right? They started to treat to test the cases, and they treat everybody. There was immediately that this triggered also this high demand, right, for more testing and then hospitalization, right? So a lot of people who want to get tested, a lot of people who want to get hospitalized, only to find that there was no hospital beds available for them. So some of them just end up dying. I heard that there was this case, from one of my friends. So the entire healthcare system was, until I think like mid maybe February 10th or February 11th, there was this time, it was completely overwhelmed by this huge demand. That there was a lack of healthcare personnel, there was a lack of hospital beds, and that only because you have so many people, right, flooded the hospitals, trying to get tested, get hospitalized, they increase the chances of cross-infection, because some of the people who want to get tested, probably they were just showing flu-like symptoms only. And those people who confirmed cases had difficulties getting accepted to be hospitalized. They were received. They didn't have the access to the healthcare. Then they died. So that also increased the mortality rate in the city and the province. So I doubt that this unusually high mortality rate in Wuhan might also have something to do with that lack of healthcare system surge capacities there. And of course, when with the availability of all those Fangchang Yiyuan, right, those mobile hospitals, right, those the Huoshenshan, Leisenshan, right, essentially that problem has been solved. So you saw actually this death rate actually began to drop. So that I think also reflects this is the weakness of the system. But in the meantime, there's the strength of the system is that they could, right, this totally state can mobilize, right, the marshal healthcare resources from elsewhere, from the military, from other parts of China. So in a short period of time, they were able to concentrate in a sufficient number of healthcare workers, healthcare resources to treat those cases in Wuhan. And I think that reflects the strength of the system.
Well, I have another question from someone who sent in a chat anonymously, asking a question that, of course, I've been thinking about too. Is this crisis in China and the way the government has handled it, is this going to increase public support for party rule and CCP? Is it going to strengthen the legitimacy? There was a lot of, we saw the people being very upset about Li Wenliang's death and frustration at the cover-up, but is that going to be forgotten in light of this very decisive action on the part of the government? And will it even include people having more support for this extensive social control and surveillance, which in this case, it looks like it may have saved lives? So if it's a question of your health or your privacy, are you going to opt for health?
Yeah, I think, well, I think ultimately this is going to be a empirical question, right? Whether
Yeah.
this crisis will lead to increase the public support, the government, or strengthen the party state's legitimacy. I was asked a couple of times about that question, and initially my answer was that there was a difference between the legitimacy of the central state and the legitimacy of the local state, right? People might not be happy with the local state, but they still show actually demonstrate their trust in the central government. So I said very likely that President Xi would model through that crisis. But actually, I didn't expect that. Actually, there was a problem. My sense is that just my sense that probably he's not just going to model through the crisis. He's going to see his legitimacy boosted by the crises. We saw that actually during the SARS outbreak, after the SARS outbreak, there was a survey, I believe, in 5 cities in China, basically asking the question, user trust in the government improved after the outbreak. Actually, more than 80% of the people said yes. So and now you're seeing that how already that there's all those campaigns, these efforts to showcase how this handling of the crisis, its effectiveness in bringing down the cases in a short period of time, and also the lack of action, but the seemingly a lack of action in the Western world, right? All this points to the superiority of the Chinese model. I think that very likely would help, the central state to get more legitimacy in the crisis.
That makes sense to me too. Is there a chance now the decision to go back to work and reopen schools, those kinds of decisions might be even more politically fraught than the initial decisions to impose quarantines? So is there a possibility that the authorities in China might encourage people to go back to work, as it appears mostly they're doing now, and that could cause another second spike in the epidemic, or not?
Well, this is possible. I think when the government now is actually actively encouraging people to go back to work, right? But the thing is that the local leaders, right? They probably asked to fulfill 2 seemingly conflicting objectives. One is that to make sure that no new cases, right? The second is that to resume production as soon as possible, right? But since this first one seems to be very more quantifiable than the second one, and seems to also reflect the top priority of the government still. So you would expect probably the local level, their top priority remains to control, right, the disease situation, make sure there are no new cases. Because if there's just one new case, they would be in big trouble, right? So that might explain why so far, as far to my knowledge, only 30% of the factories have resumed production fully.
I think it varies by region. Seton had a list, and some were up to 40 some odd percent people going back.
Yeah, there's certainly variations at the local level, absolutely.
So I have to say that as a non-expert, I'm still kind of confused about whether or not public health experts like you think that this kind of aggressive containment is really the best way to solve the problem. And certainly Italy now seems to be following the Chinese model. So it looks very effective. So should we believe that this is really the best way?
Well, I've actually given some thoughts on this question over the past 2 days. I think the issue was the decision in terms of public policy making. Leaders are not, the policymakers are not make a choice between like maximum protection of people's health and minimum disruption of the economy and the society. It's very likely, right? It's in between. We think of this as a spectrum, right? You have to balance those aggressive containment measures against those this potential negative impact on the economy and the society. So this in any I think sound public policy making, right? I think it should avoid like making this like a binary decision, right? And think the Chinese approach, I think, is basically focused on maximum protection, right? Basically, preventing the spread of the virus at all costs, right? Even though that means the damage to the economy, even though that means the implications like civil liberties, and also the second order problems, such as the healthcare for those people with conventional illness, right? So this has all become secondary, right? The top utmost concern is to contain the spread of the virus, so that is why aggressively the quarantine people, isolating patients and tracking down all the contacts. But I think that if you think about all those the social and economic costs, it's probably too high to justify as the viable approach to be copied as elsewhere. Even in Italy, I think they're similar adopting the Chinese approach by quarantining the entire country, but actually they were not as aggressive, not as draconian as the Chinese approach. I was told that even the quarantine area, you still could do whatever you want. You could leave your house as without wearing masks. So there's indeed a difference. In my opinion, the Chinese approach is, strictly speaking, not replicable, and probably should not be replicated.
Okay, well, that's a good way to close this very informative discussion. I'm really grateful that you shared your time and expertise with us, and thank you so much. And maybe we'll be able to do this again in a little while, because I certainly learned a lot. So thank you very much, and thanks to everyone who participated.
Thank you. Thanks,
Bye-bye.
everyone.
Thank you.
Bye-bye.